Okay, great. The time is exactly 17:02, and I would like to warmly welcome each one of you to this very, very important webinar on oral health and chronic diseases.
Oh, okay.
My name is Emma Chamankak, and I'm a senior lecturer at the Department of Nursing
Oh, okay.
at Laria University of Applied
Wait.
Sciences. I'm also one of the
Press E
co-founders
to.
of HEAT Finland. And just to add to that, I'm a doctoral researcher at the Helsinki University, and my area of interest is chronic diseases. I'm also a certified mediator and a coach, and I'm here with my colleague who is going to introduce herself now.
Hi, everyone. Thank you very much for being here, especially our presenters, of course, but also everyone else. We're so happy to see many of you here today, and more people will hopefully be joining soon. My name is Aina Jones. So, as Emma mentioned, I work with her during the duration of our project here. And I'm very excited to be here and learn more about oral health and chronic diseases. And I'm going to be more on the background as Emma will be hosting, especially I'm looking forward to the questions and answers. So if you have any problems, we're going to try and sort them out. So please do not hesitate to be in touch using the chat function or something else. And over to Emma again, if you want to go
Yes,
through
thank
the
you. Thank you very
program.
much. Yeah, wonderful. Thank you so much, Aino. So warmly welcome to those who are just joining. We started a few minutes ago. So here is a rundown of the program. It's very simple and very straightforward. We're having the welcome words, and then we will have a presentation from two seasoned experts from our own communities. And we're looking forward to that. And after the presentations, we will have the question and answer session. And in between that, we're going to have the questionnaire, pre-webinar survey, and also at the end as well.
然后我们黑人老师，
And this brings us to our Zoom etiquette. So as Emma mentioned already, we're recording the first, let me just show you here. So we will be recording the start, Aaesha's and Emad's presentations, after which we will be finishing the recording. So during the questions and answers, you are very welcome to speak up and ask questions, and this session will not be recorded for the questions and answers. So during the presentations, we will take all of the questions at the end. So during the presentations, you can use the chat function. Hopefully everyone can find it to write questions and comments, and we will be asking them all later on. So there's no need to worry about that. Once we've gotten to the question and answer, you can either write in the chat and we'll be asking your questions, or you can speak up by raising your hand if you can, or just asking your questions if there aren't many people speaking at the same time. When you're invited to ask a question during the question and answer, please turn on your microphone and camera. It's much nicer to answer questions when we see who's asking them. And other than that, please keep your microphones especially off, as if you are, especially if you're in a noisy location or that sort of things, just to be polite to others. And as we mentioned, we will be recording the presentations by Aaesha Yahya and Emad Al-Selwi, and the question and answers will not be recorded. If you have any issues, please contact me. well, I guess if you have issues, you might not see this particular slide then, but you can use the chat, or my contact details are on our website as well. So please go through there. And also, I'm going to mention this now. We'll be posting the pre-webinar survey and the feedback survey. So it's very important that everyone answers those. Thank you very much. And now over to Emma to talk a little bit more about Heed Finland.
Thank you so much. I know. Let me briefly introduce Heed Finland because some of you might not be familiar with it. Heed Finland is a non-governmental and non-profit making organization founded in 2018 with three main goals, which are to promote health, education, and integration of immigrants and refugees in Finland. So it wouldn't be an exaggeration to say that we are one of the leading organizations, grassroots organizations, when it comes to health promotion of immigrants, especially focusing on chronic diseases. So the webinar that is organized today is part of the Health is Wealth project that is powered by Heed Finland, which is aimed at increasing immigrants' awareness and understanding of health-related issues with a strong emphasis on making informed lifestyle choices. So a focus of the project is prevention of chronic diseases. Funded by STEA, the project targets immigrants and also refugees from Africa and Middle East, but immigrants in general, as well as healthcare professionals, including nursing students. We do have different activities as part of this project. We have individual guidance sessions, we have open well-being days, we have peer support and physical activity groups and webinars on health issues as the one we're having today as well. And of course, we do train nursing students and healthcare professionals to become cultural mediators in their work. So thank you very much, Aino.
And
Aino would
here we
probably
are.
continue now with the survey.
Yes, exactly. So if everyone could just take a few minutes now to answer the survey. We have the link also in the chat, so please feel free to go through. And while everybody is getting that ready, make sure that you do have that you're ready to answer the survey. So this is a shorter one. So if you are able to answer this one, then you can also answer the feedback form. We need the feedback, as obviously we're governmentally funded, so we do need to tell our funders that what the resources are being used for. So I appreciate every single feedback, every single answer to the questionnaire. While everybody is still doing that, I'm going to give it over to Emma again, and she can introduce our first speaker so that we can get this webinar well and truly started.
Yes, thank you very much, Aino. One of the reasons why I'm actually very excited to host this webinar, please, if you're not speaking, can you kindly mute? Thank you. One of the reasons why I'm very excited to host this webinar today is because we're having, like I already mentioned, two seasoned experts from our communities who are here to share valuable knowledge, empowering us to make informed decisions about our oral health and overall our lifestyle and well-being. So I would like to borrow the words of one of my very good friends, the CEO of Nanas TV. This webinar is for us, by us. So before I introduce the presenters, I would like to take us through some very key facts when it comes to oral health and chronic diseases. The first one is that many of us at some stage in our lives are going to have tooth decay, right? That would need help. And when your oral health is not taken care of, it might lead to issues like maybe inability to eat, to work, severe pain, infection, maybe tooth loss, and in some cases, rare cases, even death. We know that there are many public health strategies, for instance, fluoridization of water, to combat different issues with oral health, but still those are not enough, right? And there is increasing evidence to show that oral diseases or poor oral health is actually linked to chronic diseases such as diabetes, asthma, heart disease, just to name a few. So the focus of this webinar today is on prevention. And the goal is that each and every one of us who is here today will go home, take the necessary steps towards achieving good oral health, preventing oral problems, and eventually chronic diseases as well. And of course, not just that, but to share the valuable knowledge that you're going to gain from these wonderful presenters today with your loved ones and your family who are not able to be part of this webinar. So now let me start with the first introduction. So the first presenter is Dr. Aaesha Yahya. Aaesha is originally from Sudan. She completed her dentistry education at the University of Helsinki and graduated as a general dentist in 2019. So, my dear Aaesha, it's wonderful to have you, and the floor is yours.
Hello, good evening. My name is Aaesha Yahya, and I was asked to keep a small presentation about this huge topic. And I will not go very deep into details because time is limited, but I'm sure we could talk about this subject for hours and hours. But thank you for coming and showing interest in this subject. I'm very glad to hear that Emma is like thinks that this is important, and thank you for the interest. I hope you are participating through the computer because I have a slideshow. Just a second. Let's do this. Okay. First of all, I want to mention my affiliations. So I am a partner and a senior dentist at the company called Medistaff Oy. And basically we provide healthcare workers for the public sector, so hyvinvointialueet. And we provide dentists and nurses and doctors and so on. A little bit about myself. I moved to Finland in the early 90s, so I've lived here all my life, and all of my education has been here in Helsinki or Finland. And as Emma mentioned, I graduated in 2019 from the University of Helsinki. And also I did a small exchange in France, Strasbourg. So I was there for like 6 months. But otherwise, I studied here. And after I graduated, I have worked in the public sector all around Finland, all the way up to Kuusamo is the furthest place which I have worked in. And in the private sector, just like a tiny bit. Okay, so people tend to think that the mouth is a separate thing from the rest of the body, but it's actually a very integral part of the body, and it's a gateway to your body. It's connected to your body, and it's very crucial when it comes to well-being and general health. So this is something that people tend to think of as a separate thing. But nowadays, like, there has been more discussion that the oral health is important, and it it matters if your oral health is in a good state or in a bad state. Okay, smoking and oral health. Everybody knows that smoking is not healthy. It's not good for you. But how does it affect the mouth? It weakens the immune response. Of course, this applies for the whole body, but dentists see this when you.
Aisha,
Yeah.
Aisha, there's a particular position that we can't really hear you. So maybe you could
Ah,
speak a bit louder.
okay.
There's something maybe with the position.
Okay, let's see. So this is not my computer, so
Now we can hear you very well.
now, okay, thank you.
Thank you.
So this jumped a lot. Okay, here we were. So after we extract a tooth, there will be a wound in the mouth, and we can see that it doesn't heal as fast, or we will have some problems afterwards if a person is smoking. So it affects that. And we can also see when the patient opens his mouth, we can see that there is some changes in the mucosa. Some white lesions might occur. This is actually from snuska, which is not as dangerous as smoking, but it's still not safe to use snus because it affects the mucosa. It reacts to the substances. But the reason why we are worried about these white changes or changes in general in the mouth is because they can be pre-malignant conditions that can turn into something malignant, which means cancer. So we always need to be aware if we have some changes in the oral cavity. And cigarette, it causes lung cancer. It also causes mouth cancer. And the problem with oral cancer is that usually we detect it too late, and then it has spread to a large area, so it's very difficult to treat. And survival rate is from 75 to 90%. So after 5 years of detecting this cancer, 75 to 90% of the people are still alive. So not everybody survives. And probably the most common effect of smoking is periodontitis, which is, in other words, an advanced stage of gum infection. So I'm assuming everybody knows what gum infection is, but the gum infection can proceed to become periodontitis, and later on we will go through what it means. And a few words about snus. It can also cause gum recession. Gum recession means that the gum line is all the way here, but it should be here. So this part of the tooth should be covered with this pink gum. And gum recession is caused by, for example, snus, which is nuuska, or this periodontitis, or it can be from brushing too hard. But the problem with the gum recession is that it doesn't grow back, and it can be like not so nice looking aesthetically, and it's very hard to treat. It's not easy to, if you want to fix it, it's not so easy. And also when the root is exposed, it will be more sensitive to cold, for example, so you'll have like tooth sensitivity. So best way is to prevent this from happening. But the main cause for this gum recession is brushing too hard. So try to prefer an electric toothbrush because they usually have a sensor that when you press too hard, it warns you.
Mhm.
Okay, let's move on to diabetes. So everybody knows diabetes, or they know somebody that has diabetes, and roughly it's type 1 and type 2. And type 1 is the one that you are born with, it's genetic, and type 2 is something that you can get if you have a certain type of life habit. So, how does diabetes affect the mouth? In diabetes, the insulin function, insulin is a hormone that regulates the blood sugar levels. And when it doesn't work properly, there will be too much sugar in the blood. And sugar is not supposed to be in the blood, it's supposed to go inside the cells. And when it's in the blood, it reacts with the surfaces of the cells and it's toxic. Actually, it is toxic for the cells. And it affects almost every part of your body. So you can have problems with your kidneys, your eyes, your nerves, wounds that don't heal. Pretty common side effects if it's not treated well. But in the oral cavity, it does because it affects your immune system. You will have a slightly increased risk for oral infections, for fungal infections. Wounds also in the mouth don't heal as fast or as well. And it also promotes the spread of infections. So, an infection in a healthy mouth is not as severe as an infection in the mouth of a diabetic person. And also, sugar, when the sugar is in the blood, it's also in the gum fluid. Let me go back to this picture. So, inside here, there is a fluid, and it's perfectly normal. And it's secreted from the body. And when it has sugar in it, the sugar will be here and here and there. And here we have bacteria that will eat the sugar and cause cavities. So when the sugar is coming from the gums, it's quite hard to manage. And if you get cavities here in the roots, it's also not as simple to fix as in the normal areas here. And also, it does play an important part in periodontitis, which is the gum infection, and we will get back to that later. And actually, there has been a lot of research between diabetes and this periodontitis. They have this link between them. If the other one is poorly managed, the other one will be worse. We will be in a worse condition. So if you have diabetes, it's very important to take care of your oral health because it may improve the state of the diabetes. And if you treat the periodontitis, the diabetes will be in a better state. And if you treat the diabetes, the periodontitis will not be as bad. So they have this kind of relationship. Okay, let's move on to heart disease. Recently, there has been a lot of studies between oral health and heart disease, because heart disease is also quite common nowadays. It means high blood pressure or other problems with the heart. Usually, it's high blood pressure. Uh, it can increase the risk for heart attacks, which is something that doesn't come to mind if you think about your mouth. But there has been a lot of studies showing that if you have poor oral hygiene or tooth decay, or oral infections as a child, then it's more likely to have problems with the heart when you're an adult. And actually, because the mouth is connected to the rest of the body, the bacteria from the mouth can travel, and if it gets to the heart, it can cause severe problems. For example, endocarditis is quite severe infection of the heart lining, and it can be fatal. And if people have an increased risk for endocarditis, uh, they usually know about this, and they should always take antibiotics before doing any surgical procedures in the mouth. For example, tooth extraction, because there have been studies that have shown that taking this antibiotic will reduce these infections that can be fatal. So it saves lives. Also, it can cause clogged arteries, which can lead to heart attacks. And also, the risk for strokes are increased, which means like a stroke in the brain. Okay, let's move on to asthma. Asthma is a very common condition, at least here in Europe or the Western world. But actually, 300 million people worldwide have asthma, and it is caused by a state of inflammation in the airways. And when there is inflammation in the airways, the cells react. They have like this response to this inflammation, and it causes the cells or the muscles of the airways to tighten, which makes the airway very narrow. That's why it's hard to breathe when you have this asthma. And it is usually treated with an inhaler. So you breathe the medicine from this tube, and it is cortisone. And actually, asthma does not cause the problems in the mouth, but this medication does.
Naapuritalon pihan puolelle ja sieltä pois.
Somebody has their mic on. Could you please mute? Okay, so this medication causes a few problems. It is important to have the right technique to take this cortisone so it doesn't stay in excess in the mouth. It reduces the amount of saliva, and saliva is a very important part of oral health. If you have decreased saliva, which means like a dry mouth, it increases risks for everything. So the plaque, which is this gooey stuff that constitutes of bacteria. In Finnish, it's called plakki. It sticks on the surfaces of the teeth more easily, and that is the main cause for tooth decay. So you will have cavities more easily. And also, if you have a dry mouth, it increases risks for fungal infection. So many times we can see a fungal infection in the mouth because of this medication. And this Hammaslääkäriliitto has constituted these instructions for taking this medication. So you should use the right inhalation technique so that the medicine does not stay in the mouth rather than goes to your airways. And you should brush your teeth before taking this inhaler with a fluoride toothpaste. After that, you should spit the fluid from your mouth, no rinsing, Then take the medication, and after that you rinse. And after that, you should take a xylitol gum or mint. And if you have this medication, it's preferable that you drink water instead of anything else during meals, so you will not have so many acid attacks in the mouth. Okay, let's move on to tartar, or in other words, dental calculus, which is hammaskivi in Finnish. Almost everybody has tartar. It's quite easily formed, and it forms on the surfaces of your teeth, as we can see here, a little bit yellowish stuff. And it forms when the plaque, which is hammasplakki, film of bacteria, it builds up on the surface of your teeth. And if it's not removed daily, it will start to harden, because the saliva has minerals in it, and it will react with the plaque and it will become hard like salt. It's the same process that is happening in the shower, in the tap. If you don't clean it, it will become white, and then you have to scrub it. And it doesn't help if you rinse it, because it sticks very hard. So you need a professional to scrape it off. This tartar causes a gum infection. Now here we can see it's on the surface of the tooth, but it can also go deep inside the gums where you cannot see it. And there it causes problems. And we will go through that later on when we go through periodontitis. Oh, it was the next one. So gum infection is something that everybody, I assume, that knows about. But if the gum infection is not treated and it proceeds, it can lead to periodontitis, which is quite poorly known amongst people. Here in the picture, we can see a healthy situation. When we put a probe, this is like a small dull needle. When you put it in between the gum and the tooth, it can sink like 3 millimeters, just a tiny bit. But when you have a gum infection, in this next situation, the probe will go much deeper in, and then more bacteria can get in here and form dental calculus. And what happens is that the body will react to this infection load, the load of the bacteria. The gums will start to become red, and they will actually start to detach from the tooth. And as it progresses, it will become even more detached, and it also starts to affect the bone, which the tooth is anchored to the bone. And when you have periodontitis, the bone gets eaten away, and this bone you cannot get back. So it is important to prevent this. And if this periodontitis proceeds for years, usually years and years, it can cause the tooth to start moving. So you can move it with your finger, for example, and if it's like super severe, the tooth can even fall out. And the problem with this one is that it's usually it doesn't show any symptoms though, so there could be like zero pain, but then all of a sudden your tooth will start to move. And there are some risk factors that increase the risk for getting this condition: genetics, stress, hormones, diabetes, personal mouth hygiene. But the most important thing to remember is that personal mouth hygiene needs to be in a very good state to prevent this from happening. Okay, this is I think the last slide. In just a second, I'm just gonna put the last slide up again.
Very important slide.
Yeah, I know. Oh.
Okay.
Okay, I have it disappeared. Oh, okay, orthodontic problems. The thing you need to know about this is that in Finland, children are systematically screened. So children are being invited or so to the dental office, and they will be checked for any malocclusions or bite defects. There are many types of bite defects: crowding, spacing, underbite, overbite, crossbite, and so on. And usually people know about crowding and spacing, and they are very worried that there's a problem, it's not going to look good. But actually you have to have quite a severe state of crowding to get treatment in the public sector. Usually if it affects if it has like more effect than just aesthetic effects, then you will get it fixed. And usually we use this rating from 1 point to 10 points. 10 points is like a very severe syndrome that you have. You might be missing 10 teeth or so. So it's something that is treated in the hospital, and these patients have usually a lot of other problems. But in the in the public sector, perushoito, we treat from 7.5 to maybe 9 points. So it has to be quite severe, I would say. So this is how the government or the ones who decide have decided that we don't have resources for anymore. And if you, for example, have 7 points or 6 points, it would be good to treat this defect, but you cannot get it in the public sector. You can always go into the private sector, like Oral or Terveystalo or whichever place, and you can get it treated there because it's more easy to treat it when you're a child and also faster. But you would have to pay for it yourself. It's usually about 2,000 to 5,000 euros. Usually it's like 4,000 euros. But if you don't treat it as a child, usually you can treat it as an adult as well. So it's not that crucial to treat it as a child, but it's better. The results are better, and it is faster and easier because the tissues of a child they are more flexible and soft, and the teeth move more fast and so on. Yeah, but this is something that is good to know.
Yeah.
It is not game over if they tell you that you cannot get the treatment here in the public. Okay, that was the last slide for me.
Mm.
Thank you for listening, and I guess now you can ask questions if you want to
Yeah.
ask something.
We will take the questions, my dear Aisha, at the end.
Oh, okay.
So let's have both presentations, and then we have the Q&A session. I want to thank you so much for the very impactful presentation. You know, I think sitting here, I've learned something as well. So let me introduce, and dear viewers, listeners, uh, add your questions, ask your questions and your comments. Make sure you use the chat window effectively. So let's have the second presenter. So we're having Emad Al-Selwi, originally from Yemen. Emad holds a degree in dentistry and worked as a dentist in Yemen before moving to Finland. Currently, he is working as a dental assistant with the city of Helsinki. So, my dear Emad, the floor or the stage is yours. So I know we'll be sharing your slides. I know, are you there?
Yes, I am there. Thank you so much for your interview.
Yes, I'm
Yes,
just
thank you so
getting
much.
the slides up. Just a minute.
Thank you. Thank you very much.
Thank you.
Meanwhile, if you have not answered the pre-webinar survey, kindly do that. The link is there in the chat window. Yes.
Okay.
Over to you, Emad.
Okay. Thank you to have me today. So today I will speak generally about oral health. And first of all, to look presented, I'm Emad, working here in the city of Helsinki as a dental assistant. And also I make a checkup for the kids from 1 and 3 years and 5 years, like under 5 years old. Do it like as checkup. So next slides. So today we'll speak about the basic steps for like maintain oral health. So how we maintain our health like healthy or our mouth healthy. So first of all, like brushing our teeth at least twice a day. So morning and evening. And also by flossing our teeth, but actually like flossing teeth and also then brushing teeth. That's the right way to do, but it's still also okay to brush your teeth and then flossing them after that. And by also like a regular eating rhythm, it means like healthy snacking habits, and also rinsing your mouth, especially when you eat something. Like we recommended that you have water after that, so it will be like the acids in the mouth decrease like as much as possible, or as much as fast as possible. And also like a regular dental checkup. The more that you go to dental checkup, the more that you'll find out if there's something wrong with your brushing or flossing or like eating or something. So you will know your problem before it gets bigger. And if we can move to the next slide. Thank you. So like, about brushing your teeth, always like use soft toothbrush, and we recommended electronic toothbrush, but the bristle like of the head of the toothbrush, sometimes this is somehow people think, okay, I want to take the harsh one or the hard one, it will clean well. Of course, it's clean well, but it also gives like what the dentist before talk about the gingival like recession, that it means the gingiva goes up. So that's the risk that we will not recommend it for you to use it. So we recommended the soft one, so it will be safe. And electronic toothbrush, as well as that when you brush your teeth, it will know that you brush too hard, you brush too soft, because it will stop by itself. Otherwise, brushing by your hands, it's still okay and still better than nothing, but also the controlling of the force, it's still kind of, it depends about how hard you brush. And of course, brushing, it will not be like a succeed without toothpaste, sorry. So using toothpaste that has also contain fluoride, we will talk about it later. And brushing also at least 2 minutes, and 2 minutes it's a lot of time. So you have to give time for each single teeth. So for 3 seconds, like if you have the toothbrush, you have to do like 1, 2, 3 in your head. And we recommended also when you brush your teeth, brush them in front of the mirror, not like be in your head or in your phone. You forgot where I am, and that's it. So see the mirror and brush them one by one. So they will make sure that they'll be clean and you will not have any decay in future. Next slides. So about the toothpaste, so we recommended this like a fluoride, like a fluoride حمص in Finnish, and it's fluoride toothpaste. That means toothpaste that has fluoride. And here in the shops, also in the pharmacy in Finland, toothpaste contain fluoride 1,450 part per million. That it's you don't have to remember that number, but at least buy it, and it says like fluoride toothpaste, and also you can buy it from any other like food shops. Any toothpaste is fine as long as it's like contain the fluoride, but there is like specific toothpaste for specific needs. It means that if you have like a sensitive teeth, there is also like sensitive toothpaste, and someone, if you could just close the, thank you. So, and there is also like for the gingivitis, if you have like a gingival problem, so you will buy the toothpaste that have that. But I recommended that you go, when you go to the checkup, the dentist will recommend for you what kind of toothpaste is suitable for you. If we can, the next slide. And about the toothbrush, so electronic toothbrush, as we before recommended, it's more highly recommended, but any kind of brush is better than no brushing or no brush. And electronic toothbrush, it doesn't need to be the most expensive one and the most like functional one. Any toothbrush, like I'm talking about electronic one, it works. Like anyone, like anything, like you don't need to be brand or anything. You can just buy the cheapest one. It also works the same. The strong one, it's the same. Just remember to change the head every 3 months. That's the most important. And next slides. Thank you. And about flossing teeth. So about the flossing teeth, it's why we flossing our teeth. So to remove the plaque or the plaque from the sides of the teeth, that toothbrush doesn't like reach it. When we brushing our teeth, we actually brush the surface, like inner surface, outer surface, and the occlusal surface. But between the teeth, it stays, there's some like food stays, and the food, if it stays between that, it will lead to what the dentist before talk about it, about periodontal disease, that the food, it will stay there for long and it will become as plaque and also as bacterial that will also go under the gum, and it's difficult to take it. So recommendation to floss at least once per day, so or twice. So brush them between the teeth as it shows in the picture. So every teeth, like between the teeth, has two surfaces, one right and one left. So first of all, you get it in and like floss right one, and then take it again and rinse it under the water, and also again to the left side and floss them. After flossing, you can brush your teeth, or you can brush your teeth and then after that floss them. But the recommendation is flossing and then brushing the teeth. And the regular eating rhythm and also healthy like snacking. So avoid like food and drinks that are highly in sugar as much as you can, and make a gap or break between the teeth, or between the meals. So from 2 to 3 hours break there, and eat max 4 to 5 times per day. It means like try to make your food kind of regularly. So you eat. You make thank you. So between the meals, like, try to make it like 2 hours without like any eating. So it means no snacking between that. So you have like your breakfast and then until the lunch, and after that maybe some like a snack, and then the dinner or something like that. So try to make the gaps. This is really important. And between that gap, like you just drink water. So eat and like some gap to 1 to 3 hours, and then eat again. But the more that you have snacks habits, a lot of food coming to your mouth, even if you brush your teeth and floss them and brush them 2 times per day, it's still you have high risk to have like dental caries. But the snacking habits that you have to kind of make like a break between them, so you will reduce the tooth decay a lot, especially if you brush your teeth twice a day. So usually you will have zero decay. It means the caries. So you go to the next one. So, and regular dental checkup, this is actually one of the, so if I clean my teeth and floss them and I have regular food habits, that it doesn't mean that you don't have to go to the dentist unless you have pain or like a swallowing or something. This is like what we like actually known, but this is not right that we will go to the dentist and then we'll have pain. We should go to the dentist even we have perfect teeth and are clean to make sure, did I clean my teeth up really well? Do I have everything okay? Do I need to change something? My habits of eating, my way of brushing, or my way of flossing? This is really important that we forgot about it. So regular dental checkup, it will reduce that you have any decay. So, and it's really important part of like our like hygiene routine. And also, if any like decay or any like caries, they will prevent it way before it happening. And neglecting our like mouth health can use a serious effect on our teeth. So if you have some like small problem and you don't know and you think you do everything right and you didn't go to the dentist, so you will not discover it until it gets bigger, and then it needs longer procedure and more expensive. So going to the regular checkup, it will be less costly for you in the future, and you have any kind of problem, it will be like discovered before it be a big. And thank you. So a lot of like maybe asking how I can book time for like a dental checkup. Of course, you can contact city public dental health by calling, visiting, but you have to make sure that you have a Finnish ID or like a Kela card. But if you don't have it, I think you can contact your like nurse, and then they will try to organize for you a dental checkup for that. But I recommended that calling and visiting. Of course, sometimes it takes time to get like in the queue and get like your time, but still, at least you have to visit the dentist. It depends about how bad the teeth is, but it's 2 years, like 1 to 2 years, every 1 year, or 2 years. But sometimes some patient takes for 6 months if needed. This is the dentist will like make evaluation for your teeth and give you what the right time to book time. And then if you have what they call the plan or the treatment plan, according to that, you will get the time. Even if the dentist said every 6 months, you will get it like automatically every 6 months or after 1 year, but you have to book it by yourself. So, and what will happen that when you book time and you get the time for the dentist, so there is some kind of misunderstanding, especially among the immigrants people, that when you go to the dentist with like needles and pain and tooth extracting, it's not happening like that. So when you first time to go to check up, they will just have a look in your teeth, and they have mirror and the light, or kind of like simple light, but they have the kind of specific light, but it doesn't like have any pain or anything or any sharp. They will just have it, and possibly they will take X-ray if they can say, okay, there is like decay or not. I mean, by decay, I mean like caries. So they will take maybe pictures by X-ray, and also it's not anything yet hurts or anything like sharp at all. And then the dentist will see the plan and will kind of talk to you and discuss with you what's the right for you, what we can do the next visit. And also maybe we'll recommend it for you the dental hygienist. Also, as we talked before, they will take the tartar or they take the dental calculus from your teeth. That's if you have them, the dentist will recommend you to go to book time with the dental hygienist. And of course, no operation happens without mutual agreement between the patient and the dental professional. So we will not, if you have any scareness that will have a tooth extraction, it will not happen unless you agreed for that and you actually need it. This is like the last things we do.
Yeah.
I think that's all, and thank you for listening. And if any questions, will be answering.
Thank you very, very much, Emad and Aaesha, for this wonderful presentation. I mean, Emad, you were so hands-on, very practical things that we need to consider. Wow, I don't know about you, but I can tell you for a fact that there are many things I've learned from these two wonderful presenters that I did not know before, with all the knowledge I thought I have, right? So there's always room for more, and we learn every day. So I really want to wholeheartedly thank you and thank all the participants for signing in today. There are many places you could have been at this point, but you choose to be here, and this is already an indication that yes, you're taking your health very seriously. As we've heard from Aaesha and Emad, yes, chronic diseases are on the rise. It's real. There are quite many things we can do with our oral health that can actually help to prevent some of these diseases. And I just want to, before I go to the questions, I just want to say a couple of things that from the desk of the host that I would like, to re-emphasize. And I think something that also came out very strongly. And I say this because many of us here are parents. If we are not parents yet, we are planning. We're going to have kids someday. And I think what was quite interesting is what you said, Aaesha, that poor hygiene and tooth decay and oral infections as a child can actually lead to heart problems in the future. I'm sure many people don't think about this. So once again, what is that telling us? That it's not enough for our kids to come and tell us, no, I brushed my teeth already, but then that we need to follow up that they actually do it properly, right? We have to do the follow up. We need to make sure we take them to the dentist, for checkup or to dental hygienist and all of those things. So, and then another thing you mentioned, which I think is very, very important, is the those parents with kids who are having overbites, cross bites, and all of these things. That I think it's really important that even though it's very expensive, but then that we can already invest. And I say that because I am as guilty as charged. My one of my girls had it wasn't that bad, but during that time it was, of course, it's very expensive treatment. It's very expensive, like you said, 2,000 to 5,000. And the public health sector, they said that no, this is a cosmetic problem, so we're not going to do anything about it. If you want, take them to a private clinic. And trust me, I did not know, with my limited knowledge, because I said it's not a problem, but I did not know that as they grew older, it only became a bigger problem. The space also grew, bigger and bigger. And if I would turn back time, if I would go back to that time, yes, I would have invested. I would have done something already while they are still young, or why that my daughter is still young, to solve that problem. So I thank you very much for bringing this out very clear. Then for you, Emma, a couple of things you said, which I think is also very important for our viewers, is the fact that we need to rinse our mouth after we eat. When we eat, we drink water, but that's not rinsing your mouth. And I'm sure many people don't think about that you have to do that. And then personally, when I go to buy a toothbrush, well, I use electric toothbrush nowadays. But before, I was looking for the medium. I never go for soft. I always go for medium because yes, I was of the impression that the harder the toothbrush, the better it's gonna clean your teeth. So just like you said today, and I'm sure many of our listeners are probably also doing the same thing. And then you talked about any kind of toothpaste. Because, yes, we have all of these brands out there, and sometimes the difference is huge in terms of the price. And you just need to know, like you said, that you go with what, as long as it has the fluoride in it, then that should be good enough. So these are some of the things that you mentioned, which I think is really important. I really wanted to really emphasize. And the electronic toothbrushes. Yes, again, too many brands out there, but we can just go for the one that our pockets are able, to purchase, and it will still be good enough for us. So let me go. I know, do you want to
Let's
check the questions?
no, I want to, well, I want to do that as well. But
Mm,
what I really want to tell people is that we're going to stop the recording now. So just to let everyone know. So if we are inviting you to ask your question, or if you have a question that you'd like to ask, you can do so without having to worry that you are being recorded. So you can use the raise your hand tool from sort of at the bottom of the screen, or we are going to
mm,
go through some of the questions and all of the questions from the chat
mm.
now. But just to let you know, we'll be stopping the recording
Yes.
now. So everyone following us later on YouTube, where we will be posting this, thank you very much, and be in touch with your questions.